Welcome to the IBODY here in San Marino. I'm Dr. Tostado, and today we're going to be demonstrating our nutritional exam that we do with all our clients. Today we have Stefania, who will be going to demonstrate to get your body pH, your zinc levels, and iodine. 72% of the world is iodine deficient, which is critical for our body metabolism. A lot of people are walking around with a very low pH in the acidic range, which is predisposing a lot of people to disease, cancers, autoimmune disease, ongoing chronic illness. And so we test for your body pH to determine what sort of body balance we require for you to become healthier and prevent disease. Likewise with zinc deficiencies, we see a lot of people who have this critical mineral very low in their body, and by giving them the adequate zinc dosage to take on a daily basis for the next 3 to 6 months and normalizing zinc, all of a sudden they feel better in terms of their immunity, their focus, and their overall wellness and energy. So we're going to start then with obtaining the body pH with this little litmus paper. And what we do is we just take a little strip here, and we're going to place it in her tongue, and we're going to leave it here for about 10 seconds. So you just time it here. Okay. Then what I do is I color match this with our pH scale, and we're looking at a range that's definitely acidic. She's looking at around 6.6. Ideally, we want our pH to be 7.4, 7.6, then in that ballpark. And by being acidic, what I would recommend to Stefania is to put her on this balanced whole food nutrition so that she's getting adequate fish oils, B vitamins, minerals, including zinc, so that the body pH can start adjusting upward and will help with her health. The next step is we do what's called the zinc test. So we put about a teaspoon of this zinc formulation, and I have the client simply put it in their mouth. They could swish it around, but as long as they keep it in their mouth. And so we'll just do that now. Wait a few seconds. And the patient has the choice of either swallowing the zinc, which is not harmful at all, it's just a mineral, or they could spit it out. So I guess Stefania the choice. Mm-hmm. Then, you're welcome, I asked my client, did you taste anything?
Just a little bit of no, almost nothing.
Almost nothing.
Yeah.
So this is a diagnosis of zinc deficiency. If Stefania's body had adequate zinc, she would be spitting out the zinc fluid because it gives you a very bitter taste that's very immediate. Otherwise, if you taste something very mild to nothing, it means that your body is not saturated with zinc. So likewise, just like with the lower pH, and I recommend whole food supplementation to increase her body pH from acidity to balance. Likewise with the zinc, we will give her a zinc dosage so that in 3 to 6 months we can remeasure if she has adequate zinc levels, again to help with her brain function, immunity, and overall health. The third part of this exam is what we call the iodine test. So we simply paint a circle, typically on the inner arm or inner thigh, and by painting this, we see if her body absorbs the iodine content within the next 24 hours. So we make this little square, and I will ask my patient when she wakes up tomorrow morning if this patch has disappeared or if in the next few hours she knows that it got lighter. That's an indication of low iodine. And again, 72% 2% of the world is deficient in iodine, which is critical for our thyroid function. So these 3 tests done within 2 minutes can give us a quick assessment of your nutritional status so that we can then recommend supplementation and whatever is necessary to make your body balanced. Thank you very much.